The time is just gone 18 minutes past 8 a.m. and we kick off this morning talking about reports, the unvaccinated filling South African hospitals, and this is against the emergence of the COVID-19 Omicron variant. And this morning we are chatting with Dr. Waasila Jassat, public health specialist at the NICD, the National Institute for Communicable Disease. Dr. Waasila Jassat, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the program this morning.
Wa alaikum assalam. Good to be with you.
Yes, let's just talk about this report that has come out from the NICD. We're talking about the increase or the daily increase in hospitals, particularly in Gauteng. And the fact is most of the intakes in hospital are as a result of people who have not been vaccinated.
So yeah, we've been tracking the increase in cases in Gauteng, particularly in the Tshwane district, for about 3 weeks, and started to see increases in hospital admission in both the public and private hospitals in Tshwane, well over 600-700 admissions over the last 2 or 3 weeks. We do collect some vaccination data, but the National Department of Health are able to link vaccination data against all the hospital admissions, and we are seeing that the vast majority of patients who are admitted are unvaccinated.
Yes. Now let's talk about the severity of the symptoms between vaccinated and unvaccinated patients.
It's too early to say right now. We haven't done studies to be able to compare the disease in vaccinated and unvaccinated. But what we know, not just from Omicron, but the data that we have, particularly from Discovery Health, who've looked at vaccinated members and unvaccinated members, and the numbers that went on to develop COVID-19, the numbers that went on to be hospitalized, and the numbers that went on to need ICU and to die. And they find that there's a 93% reduced risk in vaccinated people for hospitalization, and an even greater reduced risk of dying if you are vaccinated. And so I think the South African Discovery Health data is very clear that comparing their members who are vaccinated and unvaccinated, that vaccination kind of reduced your risk of hospitalization and dying in hospitalization of COVID-19.
Okay, now let's talk about this latest variant, the Omicron variant. What do we know about it?
There's a few things that we always need to know about a new variant. We need to know, do the PCR tests still work against it to pick it up? Is it more transmissible? Does it escape immunity if you previously had infection or vaccine? And is it more severe? So we know thus far that the tests seem to work and can pick it up well, so that's good. Our scientists are working on studies on transmissibility, but given the rate of increase of cases and how it's spread already across other districts in Gauteng and now to other provinces as well, and also looking at how quickly it displaced the Delta variant. We saw with the Beta and Delta, it took a few weeks before it became the predominant variant. Omicron became predominant very quickly, so it's likely that it is more transmissible. We don't yet know if people who have previous immunity from the vaccine or from previous infection are still as well protected. It's likely that they're less protected and that there is some immune escape with this variant. It often is that new variants have some escape, so that you're not as well protected if you have immunity from natural infection or vaccine. And finally, with severity, it's early to say. We're doing some analysis at the NICD. But at the moment, anecdotally, and from looking at our hospital stats, the admissions thus far are not severe. But you would expect that in the early part of the pandemic, in the early part of a wave, when the hospital beds are still not at strain, people are more likely to admit milder people as a precaution. And so, at the moment, the picture that we're seeing of milder disease, the picture that our doctors, GPs, and hospital doctors are reporting of patients being milder, is good, but it's early days, and we should wait over the next few weeks to see how the wave progresses.
Yes. Now, also just to understand the variant, and we will have to believe that this came out of Botswana, and we are now seeing this variant featuring more in South Africa. but just trying to understand from a scientific perspective in terms of these variants. And we know that right across the entire world, when one looks at what is taking place in Europe, for instance, I'm not too certain, and perhaps you can guide me with this, Dr. Jassat. The variants, do they differ from country to country? And also looking at us here in Africa, because we've got a much lower vaccination rate compared to the rest of Europe and some of the other wealthier nations. Are we likely to be impacted more severely, when these type of variants come out?
Yeah, so a few things there. So in terms of variants emerging, we know that viruses mutate. It's what they do, and it's expected. And some viruses more than others. And we've seen from the start of COVID-19 that this particular virus, SARS-CoV-2, has mutated. Some mutations, do not confer any advantage to the virus, and they just probably fizzle out and don't dominate. Other mutations cause it to become more transmissible or more virulent or cause more severe disease, and those start to predominate. So we saw, for instance, Beta dominating in our second wave, Delta dominating in our third wave, and we've seen a few variants of concern that spread far and wide across the world. Now, we often don't know where the variant emerged, and I don't think it's important because it's not a South African variant or a Botswana variant. It's a variant of concern. It's spread to well over 20 countries now. And as we've seen with other variants, it becomes a global concern. Now, whether South Africa is going to be more affected by it than other countries, other countries that have very high vaccination coverage are likely to avoid seeing huge increases in hospitalizations and deaths. So I'll give you an example of the UK. They achieved reasonable vaccine coverage after their second wave. And in their third wave, when they were affected by the Delta variant, they had very high numbers of cases, like huge surges of cases, but they had relatively very few hospital admissions and deaths as compared to their second wave. And so what everyone needs to understand is vaccinations don't necessarily prevent you from getting the infection, especially with the variant. Variants can escape that immunity that you get from a vaccination, and that's okay. That's not really the main purpose of the vaccine. The COVID vaccine is meant to protect you against severe disease and dying. It's supposed to reduce your risk of getting very sick and dying. And so we saw that in other countries. Countries with very high vaccination rates have much, much lower, very low death rates from COVID-19. Countries with low vaccination rates have higher death rates. And so, South Africa with a vaccination coverage of less than 40%, it's likely that we will have a big surge. It's likely we'll have many cases. But I think it remains to be seen how severe this variant is. And how much immune escape it causes for us to really then be able to understand how much hospitalization and death we might expect in the fourth wave.
Yes. Now, obviously, there are those who are still very, very skeptical when these variants come out. And sometimes questions are raised as to how these variants can be predicted. And we know that in May already, we heard about a variant that will come out in December. And people are skeptical, saying that, how can this be predicted? And also in terms of variant after variant that we will possibly be experiencing going, into the future, how much longer do we have to live with these variants? But these are valid questions. These are genuine questions, and people are sometimes skeptical as to, these variants and how accurate sometimes these predictions may be.
Yeah, I mean, I've noticed throughout this pandemic, there's a sense of mistrust and unease in, trusting the information that's given to you. And I understand, people are fatigued as well. People are, skeptical about what they hear, and they've been fed a lot of misinformation. And so, yeah, when you see that someone predicts another wave and then that wave happens at the same time, people are saying, oh, it's planned. But really, it's the excellence of our epidemiologists in our country that have been doing a lot of hard work. Many of us have had not a day's leave for almost 2 years. So, we've looked at the sort of the experience of the other waves. We've looked at the size of the waves, the timing of the waves, the timing between waves. It's almost a certainty that new variants will emerge. That's not something that's hard to predict. It's just a nature of the virus. And so we know that there's a huge wave, and then a settling of the cases, and then very little transmission of the virus between people. And then the emergence of a new variant sparks a new wave. And I think just in terms of the timing we saw between the first and second and the second and third wave, we knew it was highly likely that another wave would emerge at the end of the year. And it's highly likely that, variants would be behind that. So I think these are just, work of modelers and epidemiologists in predicting how viruses work and how they behave. But I don't think it points to sinister intent of this pandemic being artificially created or spread for any sinister gain.
Yes, and just in terms of precautions, now we know we're heading into the holiday season, and we may possibly see events and guarding against what is termed super spreader events, Dr. Jassat.
Yeah, I think what we've learned a lot, all of us, not just the scientists, but every person, across the world. We've learned a lot in the last couple of years. And I think let's go to the basics. What we really do know is that, between waves, it's probably safe to socialize because there isn't much virus being circulating. But at the wave, when there's increases, your chances of contracting the virus are higher with any exposures that you have. And so we know that we need to limit our social gatherings now. Whether government goes on higher levels of restriction or not is immaterial. For me, I've already made sure that my son does not socialize as much, that we limit socializing with other people as already. And so I think we know that we need to do that after 3 waves. During a wave, limit your social gatherings, stick to your bubbles. The second thing, very important thing, if you have any symptoms, isolate. Having a cough and scratchy throat and a fever and then dismissing it and saying it's just a cold or it's just a flu. No, there's a wave now. There's a variant circulating that's highly transmissible. If you have any symptoms, it's very likely that it is COVID. And so don't dismiss it and go and mix with other people. That's criminal. So if you have any symptoms, isolate and then test and then do all those home remedies and consult your medical doctor to make sure that you manage it. So isolation, absolutely important. And then, of course, wear your masks and take necessary precautions. Avoid gatherings indoors. Try to stick outdoors and in well-ventilated places as much as possible. And then, of course, vaccination. I know people still have concerns, but the reality is I've shared data from Discovery. This is hard, cold data. There's no agenda behind it. I have no agenda. Discovery, looking at the number of vaccinated members and unvaccinated members and how many go on to be hospitalized and died, and similar data from around the world, is very, very clear that vaccination reduces your risk of severe disease and death. It's as simple as that. And we haven't seen many side effects. Everyone in my family, from my oldest aunt of 84 years to my son of 17 years, is vaccinated, and we've all been fine and had no side effects. It's important to be vaccinated, because if you choose not to be vaccinated, then be very cautious. Someone around you may be, you may get the infection, you may transmit it to someone around you, and they may go to hospital. And that's something that we need to be very conscious of. We vaccinate for ourselves to prevent and to protect against severe disease and illness and death, but we vaccinate to protect others, those around us who can't be vaccinated, like young children, and those who are older and sicker and may not mount as good an immune response and are still at risk. And just to say, the doctors in the Tshwane pediatric hospitals are saying all the kids that were older were not vaccinated, those who were eligible that were admitted with COVID. And all the young kids who were admitted, none of their parents were vaccinated. There were only 3 whose moms were vaccinated, not the dad. So this is a conscious choice of parents not to vaccinate, and their children, young children under 2 years, are ending up in hospital with COVID-19. So I think everyone has a lot of thinking to do and a lot of difficult decisions to make over the coming weeks. But my advice is vaccinations are safe. Vaccinations protect you and those around you. And in the, kind of at the start of this wave that we don't really know very much about, but we know is highly transmissible, my advice is get vaccinated early.
Yes, just finally and very quickly, Dr. Waasila Jassat, I've just got a message that has come through on my phone, and I just need a quick comment on this one here, where the viewer is saying the Omicron virus is well placed in time for pharmaceutical corporations to push for a third boost and control all patents. And now this says against South Africa, reduced to begging for vaccines. Connect the dots.
Yeah, I mean, I won't comment on the political and sort of the financial implications of all of this and, all the geopolitical forces. That's not my concern. What I'm concerned with is the facts around immunity from vaccines. And we've seen in other countries that immunity does wane after natural infection and after vaccination. And it's likely that people will require a booster dose. In other countries, they're already offering booster doses to everyone. In South Africa, the healthcare workers have already started receiving their boosters, and they're going to offer boosters to those over 60 in December, probably. I don't think that's something sinister. It's about protection. You're fully vaccinated after 2 doses, but we're starting to see immunity wane, and so it's likely that you need a booster vaccine dose. I don't know about any sinister agendas behind that, but the science behind that is very clear, and it's just related to waning immunity and the need to boost that immunity. It's actually not unusual. Many vaccines require a few doses to get to optimum immunity levels.
Well, shukran for that. Jazakallah khairan so much for your time with us this morning, Dr. Waasila Jassat. We wish you all the best, inshallah. Allah accept, Allah reward your efforts. Allah keep you in good health as well, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
Dr. Waasila Jassat, and we're going to go for a quick break. We'll be back.